Did you know something you take for sleep, allergies, anxiety, or even bladder control could be quietly affecting your memory? Most people think dementia risk is only about age or genetics, but research shows certain common medications may increase the risk of cognitive decline, especially when taken long term. Let's break down which ones and why. At the end of the video, I will suggest some alternative medications that you could talk to your doctor about. Disclaimer: this video is for educational purposes only, not medical advice. Before we talk about the medications, you need to understand one key brain chemical, acetylcholine. It carries messages from your brain to your body through nerve cells. It's essential for memory, learning, focus, arousal, and muscle movement. In conditions like Alzheimer's disease, acetylcholine levels are already low. So what happens if a medication blocks it? Memory can suffer. The first category of medications are anticholinergic medications. This is the biggest category linked to dementia risk. These medications block acetylcholine. Common anticholinergic medications include common medications such as antihistamines, over-the-counter sleep medications, overactive bladder medications, IBS medications, and tricyclic antidepressants. In a large study published in 2019 in the JAMA Network, dementia risk increased with taking higher doses of anticholinergic medications over a long period of time. Studies show that people older than 65 years of age taking these medications are at an increased risk. Popular antihistamine medications that increase risk of dementia include diphenhydramine, popularly known as Benadryl, chlorpheniramine, and sleep medications like Tylenol PM and Advil PM. These are mainly used for allergies or sleep. Tricyclic antidepressants include medications like amitriptyline or endoxifen, commonly known as Silinor. They are used for depression, pain, or for sleep. Overactive bladder medications include oxybutynin, also referred to as ditropin, Tovi and Stepium or Sanctura. And IBS medications include hyomine or Levin and dicyclamine, commonly known as Bentyl. Here's the concern. When these medications are used regularly over years, studies show a higher incidence of dementia diagnosis. Why? Because blocking acetylcholine long-term may reduce brain signaling efficiency, lower cognitive reserve, and possibly accelerate memory decline. The risk increases with cumulative dose, meaning the longer and more often they're used, the higher the concern. Research materials used in this video will be included in the description below. The second category of medications are benzodiazepines. They are used as sedatives for anxiety and sleep. Examples include alprazolam or Xanax, lorazepam or Ativan, diazepam or Valium, and fluopam or Domain. These medications enhance gamma-aminobutyric acid or GABA, a calming brain chemical that slows activities of the neurons in the brain. In the short term, they reduce anxiety and help with sleep. But in the long term, they can impair memory consolidation, increase confusion, reduce cognitive sharpness, and increase fall risk. Some large observational studies have found higher dementia rates among long-term older adult users. Long-acting benzodiazepines such as diazepam and fluorapam increased risk of cognitive decline is compared to short-acting benzodiazepines like Xanax and Ativan. Now, it's important to understand this does not prove they cause dementia, but the association is strong enough to be cautious. If you are taking these medications, don't stop them abruptly. Talk to your doctor first. Another group of medications that can increase risk of dementia are the ZAD drugs for sleep. These are the popular sleep medications Zolpidem or Ambient and Ecopipone, commonly known as Lunesta. They work similarly to benzodiazepines. They are meant for very short-term use. Chronic use may disrupt deep restorative sleep, interfere with memory processing, and reduce the brain's nighttime cleanup system. Poor sleep quality itself is linked to cognitive decline, so long-term reliance may compound the issue. 4 are antipsychotic medications in older adults. Examples include haloperidol, quetiapine, and risperidone. In elderly patients, especially those already diagnosed with dementia, these medications increase stroke risk and can accelerate cognitive decline. They can be necessary in some cases, but they require careful monitoring. Another category of medications is opioids. Heavy opioid use for a long period of time increases the risk of dementia. A randomized control study published in 2015 found that people who had heavy use of opioids for chronic pain had an increased risk of dementia as compared to those who did not. The study was not very conclusive as to whether it was the medication use or the effects of chronic pain that increased the risk of dementia. More research is needed in this area. Opioids include morphine, fentanyl, hydromorphone, and hydrocodone. Lastly is proton pump inhibitors. Examples include omeprazole or Priloc, pantoprazole or Protonix, lansoprazole or Previst, and isomeprazole or Nexium. Some research suggests possible links to dementia potentially through vitamin B12 deficiency, because long-term intake of proton pump inhibitors decreases absorption of vitamin B12, magnesium imbalance, and changes in brain chemistry. PPs have been shown to cause proteins called beta amyloid plaques to build up in the brains of mice. This protein buildup is associated with dementia. However, evidence here is mixed and not as strong as the earlier categories. It's important to note that these medications are linked to dementia. This does not necessarily mean that they cause dementia. The risk increases with taking higher doses of these medications for a longer period of time, especially in adults over 65 years of age. If you were taking any of these medications, don't panic and don't stop taking them without speaking to your doctor to see if there are other alternative medications you can take that are safer long term. Some safe alternatives over-the-counter sleep medications include melatonin, magnesium glycinate, and ashwagandha, which are not anticholinergics. Instead of Benadryl for allergies, use Claritin or Algra, commonly known as second-generation antihistamines. They have minimal effects on the central nervous system. Using Benadryl should only be for a short period of time, not long-term. There are also alternative medications for bladder control that are not anticholinergics, like beta-3 agonists, such as Myra. People who should be most cautious are adults over 60, anyone with mild cognitive impairment, people taking multiple medications, and those with kidney or liver dysfunction. Your memory isn't just about genetics. Sometimes it's about what you're taking every day without realizing the long-term impact. If this was helpful, share it with someone who takes medications regularly, especially an older loved one, because protecting your brain starts with awareness. Like and subscribe to Simple Vital Health. Thank you for watching.